Today at 6, from schools, from hospitals and from local government, warnings that the coronavirus testing system is in crisis. Even where infection rates are highest, there are now complaints of confusion and delays. Boris Johnson has admitted there is a problem with testing capacity, but says there'll be new guidance on who will get priority. Good evening and welcome to the BBC's News at 6. Whether it's teachers or doctors, local government officials or health experts, all of them are united today in warning that the coronavirus testing system is at breaking point. Even in Bolton, which has the highest infection rate in England, there are reports of delays and confusion. Let's look at Bolton. 196 people out of every 100,000 have COVID-19 and cases are rising. More than 100 people turned up yesterday at A&E asking for a test. Hospital bosses have now urged residents not to do it unless absolutely necessary. Ministers say there has been a huge increase in demand for tests and, according to the Department of Health in England, 1 in 4 of those asking for tests has no symptoms at all. Our health correspondent Dominic Hughes reports.
Just one in, you've got one QR code.
In Bolton today, some had been able to book a test, but reports suggested that didn't last long. Testing capacity ran out in Bolton and many of the other worst affected areas. Others never made it past the front gate.
We've not accepted anyone without bookings just at the moment, sir.
Even in the town with the highest infection rates in the country, there's confusion about how to get a test.
Turned me away, said you need to go online, book an appointment, but I wasn't aware of that. Nobody's ever told me that. It wasn't clear online, or I really didn't know.
We could be spreading it. We haven't got a clue.
It's difficult, isn't it? If you can't get a test, then what are you meant to do, yeah?
Yeah.
And I've tried this morning, I'm out on computer for hours. I can't get through.
My room, bedroom, TV there, where my baby would normally sleep.
Ryan Gladwell has been stuck in this bedroom for 7 days. Isolating from his baby son and partner, he's got all the key symptoms of COVID-19, but for a week now has been unable to book a test.
It is chaos because you can't have a testing system that when it needs to be called upon by any member of the public, no matter what their age, demographic, whatever, they should be able to get a test wherever they are in the country. I can't understand why it's going on so long.
Here in Bolton, the town that has the highest infection rate in the country, this testing centre seems to be working relatively smoothly. But the government has put extra resources into testing centres in hotspots like this, so there are more slots available. But the infection rate across the northwest of England has risen dramatically, and that is putting real pressure on the system.
Tracing those who've been in contact with people who test positive is the other key part of the programme, and that too is facing problems. In Greater Manchester, last week, more than 3,500 contacts were missed.
There should be a relentless focus, actually, on fixing this system. And this is what we've put forward today. You know, we're prepared to play our part.
Testing, tracing and isolating are vital elements in containing COVID-19. This evening, in the worst hit areas of the UK, it looks like this strategy is facing real problems. And tonight, here in Greater Manchester, the Mayor, Andy Burnham, has announced his intention to try and enlist the help of hundreds of PCSOs and fire officers to help boost those numbers of people who are being traced. But these issues have been coming from right across the region. We've spoken to people in Lancashire, in Warrington, on Merseyside, all of them expressing the frustration around their inability to book a test quickly.
Dominic, thank you very much. Now, as we've heard, the demand for tests has gone up over the last couple of weeks, but does that account for the problem, some would say crisis, in the testing regime across the UK? Our health editor Hugh Pym has been taking a close look at how the testing system works.
Long waits and frustration for people in Southend queuing at a walk-in virus testing centre today. Further evidence of the immense strain on the whole system.
I dropped my daughter off with my granddaughter. She was about 350 people behind all these to be told that they cannot get tested because they don't have enough. They only had enough tests to do for about 150 people.
Beth, who lives in Surrey, has been trying repeatedly since yesterday to book a test but can't. She and 2 of her children have symptoms.
It's extremely stressful. It's added a lot of stress to what is already, an upsetting time for us. While we're managing everybody being poorly, trying to get through and constantly try to check my phone just to try and hope that we find a test somewhere, and it's really frustrating, to be honest.
The government says the UK is testing more than other leading European countries, and that is the case with the number expressed relative to the population. There are, though, some smaller European nations doing more. But laboratories analysing the tests here are struggling to keep up with the workload. The government says new labs are coming on stream, but not for a few weeks. Here's how much community testing, not including NHS staff and patients, has gone up in recent weeks. On September the 1st, there were just over 119,000 tests processed. That day, lab capacity, the ability to handle those tests, was 156,000. Then over the next couple of weeks, demand soared, with 163,000 tests processed in one day. On September the 10th, capacity was 161,000. Now, it would have gone up a bit over the next few days, but it still shows how tight things have become.
And things like going back to schools.
One health expert told me all this should have been anticipated a few months ago.
The surge in demand for testing in this, as we enter autumn, was extremely predictable, particularly because we expected COVID cases to increase again as autumn comes, which we're seeing they are, but also we were expecting COVID-like symptoms from conditions such as the common cold and flu to increase too, and both of those combined for an increased demand in testing.
Back in July, people were being actively encouraged to get tests.
If you're just worried, if you've got a temperature, you've got a cough, or you're just not quite sure that you feel right, the sensible thing to do in this COVID world is to go and get a test.
Now it's very different. Capacity's much tighter, and the message is that only those with symptoms like high temperature should book a test. Confusion over what to do may well have added to the recent surge. Hugh Pym, BBC News.
Well, the latest government figures show there were 3,991 new coronavirus infections recorded in the latest 24-hour period. That means the average number of new cases reported per day in the last week is 3,286. And 20 deaths were reported of people who died within 28 days of a positive COVID-19 test. And that means, on average, in the last week, 13 deaths were announced every day, taking the total number across the UK to 41,684.